Welcome to the Explainer. Okay, so today we are tackling what is honestly a notoriously high-stress scenario from the MRCPCH clinical exams. We're talking about the Breaking Bad News Communication Station. If you're gearing up for this exam, you already know that your communication skills are tested just as ruthlessly as your actual clinical knowledge. So, we're going to break down a really common scenario step by step using the source guidelines so you can walk into that exam room completely ready to crush it.
Delivering unexpected bad news to anxious, probably sleep-deprived new parents, all while an examiner silently grades literally every word you say? Yeah, it's incredibly daunting. But there's actually a super clear, structured framework you can lean on to navigate this perfectly. And today, we're focusing on exactly how to handle a ventricular septal defect, or VSD diagnosis for a newborn. To pull this off, the source material gives us a rock-solid 6-step checklist. We've got the clinical prompt, building rapport, the anatomical explanation, reassurance and statistics, highlighting red flags, and finally, summarizing and support.
Okay, let's start with step 1, the clinical prompt, essentially setting the scene.
Before you even turn the handle and walk into that room, you're given your clinical anchors. For this simulation, you're stepping into the shoes of the pediatric specialist registrar. Your patient is little 2-day-old Tony. He's in for a routine follow-up because an abnormal heart sound was detected. A cardiologist has already done a jelly scan, an echocardiogram, and it revealed a 2 mm muscular VSD. Your job? You need to explain this diagnosis and the management plan to his totally terrified parents.
Moving right along to step 2, building rapport. These are the crucial first 60 seconds.
The moment you step into that room, you're setting the entire tone. The examiner is literally watching your empathy right out of the gates. The guidelines suggest this fantastic sequential 4-part opening. First, you introduce yourself warmly and confirm who you're talking to. Second, congratulate mom on the birth and check on her recovery. It's a small touch, but it shows real holistic care. Third, because you know bad news is coming, gently offer an attender or a nurse to be present. And fourth, and this is absolutely critical, you have to check their baseline.
You really want to use this exact phrase. What do you know so far about Tony's condition? Using this is honestly a brilliant little exam hack to gauge exactly where their heads are at. I mean, they might know about the abnormal sound and the jelly scan, but they probably don't know the actual diagnosis yet. Checking their understanding first lets you seamlessly fill in the gaps without talking down to them, or worse, completely overwhelming them.
Next up is step 3, the anatomical explanation, where we simplify the science.
Once you rip the Band-Aid off and state clearly that the scan revealed a hole in Tony's heart, a VSD, you absolutely have to drop the medical jargon. Interestingly, the source highly recommends literally drawing these concepts out on paper. Drawing visualizes the unseen, right? It really anchors the parent's understanding while they're sitting there in a state of total shock. So you'll want to sketch out 2 super simple diagrams right next to each other.
For the first drawing, the normal heart, explain that it's got 4 chambers. You have 2 upper receiving rooms, called atria, and 2 lower pumping rooms, called ventricles. Make sure to clarify that the right side holds low oxygen blood, while the left side has the high, pink, oxygen-rich blood. Then you seamlessly transition to your second drawing, which is Tony's heart. Show them that there's a tiny hole in the muscle, the septum, right between those 2 lower pumping rooms. Because of this hole, blood is actually mixing between the left and right sides, which leads to more blood flowing into his lungs. This side-by-side contrast beautifully translates all that complex anatomy into mechanics that anyone can easily picture.
That brings us to step 4, reassurance and statistics, which is all about managing parental anxiety.
Naturally, hearing the phrase hole in the heart is going to absolutely terrify any parent, so you have to immediately pivot to a deeply reassuring tone. First up, confirm that a 2 mm VSD is really, really small. Then you've got to tackle the guilt. Parents almost always ask why the prenatal scans miss this. You must gently but firmly explain that they did absolutely nothing wrong. Prenatal ultrasounds are great, but they simply cannot catch every tiny abnormality while the baby is still in the womb. They're also inevitably going to ask about treatment and surgery. And here is where you get to deliver some much-needed relief. Acknowledge their worry for sure, but explain that while large VSDs might need surgical correction around 6 to 12 months of age, Tony's situation is different. Emphasize that his VSD is small. Initially, it really just requires close follow-up with the heart doctor to see how it naturally develops.
Another massive source of anxiety you'll face is about future pregnancies. They are going to be terrified that a future sibling will have the exact same issue.
When this comes up, you can share that VSDs don't typically run in families. The general population risk is roughly 3 to 4 per 1,000. You should be transparent and note that yes, having one baby with a heart condition raises the risk slightly for the next, but reassure them that they'll be given specialized prenatal follow-ups for any future pregnancies to keep a close eye on it.
Okay, step 5, highlighting red flags, or as we know it, safety netting. Now, we've reached a totally critical pass-fail requirement of the MRC-PCH exam. The source text gives a really fascinating tip here. You actually need to subtly shift to a much firmer tone, and even slightly raise your voice so the examiner clearly hears you doing your safety netting. Look the parents right in the eye and explicitly warn them to seek immediate medical help if Tony's heart races, if he has any shortness of breath, or, crucially, if they notice any bluish discoloration around his lips. And finally, step 6, summarizing in support to close out the station.
As that incredibly fast 9-minute timer ticks down, you need to seamlessly wrap up this massive amount of information you just dropped, all without sounding rushed. Just summarize the main headlines. It's a small hole, there's some blood mixing, and he needs cardiology follow-up. Then be sure to offer a trusted website and a parent support group. You want to do this to keep them far, far away from scary internet rabbit holes. Reiterate one last time that babies with similar VSDs go on to live very healthy, near-normal lives.
Throughout this summary, and especially at the very end of your explanation, you want to use a highly empathetic check-in phrase, something like, "Are we on the same page until now, Mr. and Mrs. First?" Doing this ensures they've actually absorbed the consultation, and it leaves the examiner with a lasting impression of really solid, compassionate, two-way communication.
Well, I really hope this explainer gives you the structural confidence you need to handle breaking bad news in the exam room. But it leaves us with a pretty interesting thought for your wider practice. If mastering how we communicate a diagnosis is graded just as heavily as making the diagnosis itself, how much more focus should we be putting on our daily bedside manner, even outside of an exam setting? Keep practicing that chronological flow, and you're going to do great.